It's one of the most pervasive and least understood medical conditions in the world today. According to recent statistics, millions of people are living with headaches, which affect up to 1 in 20 Americans. Headaches should not be ignored. Head pain can be the harbinger of medical emergencies, such as a brain tumor or an aneurysm, cutting a life short. Far more common than a brain tumor is a migraine, a severely debilitating kind of headache. Widely and inaccurately believed to be just a really bad headache, migraine is an extraordinarily common neurological disease affecting 36 million men, women, and children in the United States, 26 million of which suffer attacks on a near-daily basis. Migraines can last from 4 to 72 hours, and more than 90% of sufferers are unable to work or function normally when stricken. For many headache sufferers, this ongoing pain significantly diminishes their quality of life.
For people who are suffering with chronic headaches, most likely they've been to their primary doctor, and they may have been to their eye doctor and their dentist. So the main point for those folks are, if you're not getting successful treatment where you're going, then it's time to seek out treatment with a headache specialist. There are warning signs, and we classically teach doctors that there are 3 things that they have to pay attention to. So it's first, worst, and focal. So the first time anyone has a headache, someone's never had a headache before in their life, and suddenly they get a debilitating headache and they can't function. That's time to go to your doctor, because that's a big change. Now, even if you had chronic headaches, if you suddenly get the worst headache of your life, completely different from other types of headaches, that's important. Sometimes these can be the first warning sign of an aneurysm that's ready to burst. And if you get to the doctor in time, we can help. The other one we say is focal. So if someone has weakness, incoordination, or difficulty sensing a part of their body along with their headache, that's not normal. And so those folks need an investigation.
A board-certified neurologist and headache specialist, Dr. Michael Ament has dedicated his life to helping people with headaches find a comfortable, narcotic-free solution to their chronic pain. Believing the right diagnosis is the best way to ensure a lasting and livable treatment plan, Dr. Ament finds the root causes of headaches, offering headache remedies and migraine relief here at the Ament Headache Center in Denver, Colorado.
Our goal is to help people relieve their suffering, to be able to take back their life, to come up with a solution to their problem that's both livable and workable for them on a daily basis. The difference here is that because we spend so much time to unlock what's the cause of the pain, a lot of times we can get significantly better results than people have had before. For example, we've had people who have had headaches for 40+ years, and after finding out what the right diagnosis was, they're fixed. They have 1 headache a month.
Dr. Ament and his talented, compassionate staff offer a full range of innovative headache interventions and migraine treatment, including cranial nerve blocks, trigger point injections, and Botox treatments for migraine.
Botox is one of the many treatments that could potentially be used for migraine, and it's especially good for people who are in chronic migraine, where people are suffering with headaches 15 days of the month or more. These people have tried a lot of pills, and they're not getting better. The advantage of Botox is, first, its phenomenal success rate in decreasing the frequency of the headaches, and next, they don't have to take a pill every day. The person who has Botox performed once every 3 months. Trigger point injections are another option, and they're an adjunct to physical therapy and working with muscles. Sometimes people have tender points that whenever you touch them, it exacerbates their headache. It just triggers it right off. So if you can combine a small injection into that muscle with good physical therapy, sometimes you can unlock the whole problem and a lot of the problems melt away. Sometimes we use nerve blocks. If a person has an injury specifically to a given nerve, and sometimes that can be the source of the pain. So the way we treat it is to do an injection of medication to eliminate that pain.
Because every person's experience with head pain is unique, the Ament Headache Center takes the time to treat the whole person, designing a comprehensive headache treatment plan specifically for you that not only reduces your pain, but improves your life.
He diagnosed me with glossopharyngeal neuralgia, which is a class of neuralgic conditions that usually cause facial pain, but for some reason caused headache pain with me. I finally had brain surgery to alleviate this, and I'm mostly headache-free. I'm back to doing hobbies and participating with friends and family where I wasn't before.
Ongoing headaches interfere with all aspects of your life, but there is hope. Seeing a headache specialist can help find out exactly what is causing the problems and develop a proper strategy for managing and treating the headaches with lasting results.
I've been suffering for about 8.5 years. I've seen 8 or 9 neurologists. I've been to the Cleveland Clinic, the Mayo Clinic. Dr. Ament looked over all the previous work that had been done and discovered that there were areas that were left unexplored. So he looked into these areas and found a spinal fluid leak, which is the root of my problem. Everybody else seen it but would not explore it, and thanks to Dr. Ament, it's all going to be taken care of and patched.
The best part about being healthy again is having my life back. I've been reading books. I hadn't read a book in over a year. I'm going out to dinner with friends. I'm babysitting my godchildren again. I'm just living my life.
The goal is to get you better. And if you're not getting success with the routes you've been taking, you should know that there are headache specialists out here, and we do this all day long. We listen to people who come in with headaches and we help to find a solution for them. So if you're one of those people, I hope you find a headache specialist.
If you're tired of living with debilitating headaches and using products that only mask the pain, safe expert care is available. Don't suffer needlessly. Visit a headache specialist and take back control of your life. For more information, go to amentheadachecenter.com or call 303-834-5677. Are you tired of suffering from debilitating headaches or migraines? The Ament Headache Center in Denver offers headache and migraine relief to people in search of a comfortable, narcotic-free solution to their chronic head pain. A board-certified neurologist and headache specialist, Dr. Michael Ament believes listening first is the best way to ensure a lasting and optimum treatment plan for your headaches.
Dr. Ament is my hero. He spent a great deal of time getting to know me and understanding what I was going through, and was genuinely concerned.
We quickly find the root causes of headaches and offer a full range of proven headache treatments, only using prescription drugs as a last resort.
I think I now would still be living with daily migraines and no quality of life if I hadn't seen Dr. Ament.
Stop suffering needlessly with migraines. If you've been to your primary care doctor or maybe someone else and you're not feeling better, come see us. We can help you get your life back.
For more information, go to amentheadachecenter.com